Hey everyone, and welcome to The Explainer. Today, we're doing something really exciting. We're taking complex medical data and clinical guidelines and translating them into clear, actionable knowledge. We are looking at a massive shift happening right now in headache medicine. We're moving away from a purely pharmacological model and stepping into a really sophisticated, integrative framework.
All right, let's just jump right in with a pretty provocative question. One that kind of challenges everything we assume about natural pain management. Can a simple vitamin or mineral actually rival a heavy-hitting prescription drug? You know, patients dealing with migraines, tension, and cluster headaches are increasingly looking for alternatives to standard drugs, mostly because of brutal side effects like weight gain, cognitive dampening, and severe gastrointestinal distress. So the clinical imperative right now is to evaluate natural compounds not just as weak little alternatives, but as primary, evidence-based therapies.
So here's our roadmap for today. We're going to cover the brain's energy crisis, the big three targeted supplements, botanicals and lifestyle interventions, critical interactions, and finally we'll wrap up with the Snoop red flags.
Let's kick things off with Section 1, the brain's energy crisis, fueling the system. For the longest time in headache medicine, we focused heavily on blood vessels. But actually, current data points us to something called cortical spreading depression, or CSD. Imagine this massive rolling wave of electrical depolarization just sweeping across the brain. That wave is what causes the visual aura in a migraine, and it's what triggers the deep, throbbing pain pathways of the trigeminal nerve. When the system misfires, the results are incredibly dramatic.
But why does this crazy electrical storm even happen in the first place? Well, enter the metabolic brain hypothesis. I want you to think of your brain like a hyper-excitable smartphone that's running on a really old, failing battery. When your mitochondria, the powerhouses of your cells, fail to produce enough ATP energy, the brain's baseline energy just plummets. This bioenergetic insufficiency leaves your brain incredibly hyperexcitable and super vulnerable to triggers. It's literally a system starving for efficient fuel.
Moving right along to Section 2, the big three. That's magnesium, riboflavin, and CoQ10.
So let's start with magnesium. The absolutely crucial thing to understand here is that magnesium is basically your brain's gatekeeper. It physically blocks the NMDA receptor channel in your neurons. When you lack magnesium, which by the way is incredibly common, especially when we're stressed out, that gate is just left wide open. Calcium rushes into the cell, triggering a massive storm of hyperexcitability, and boom, that terrible wave of cortical spreading depression starts. Also, form really matters here. Magnesium citrate is highly soluble but can act as a laxative, whereas magnesium glycinate is highly bioavailable and way more gentle if you have a sensitive stomach.
Now, what about riboflavin, or vitamin B2? This acts as a literal coenzyme for your mitochondria's electron transport chain, and this beautifully illustrates the power of targeted nutraceuticals. Clinical studies show that a high dose of 400 milligrams daily is statistically just as effective for migraine prevention as heavy-duty pharmaceuticals like sodium valproate. The game-changing difference? Riboflavin doesn't cause the weight gain, hair loss, or that severe fatigue.
Take a close look at this table, because setting expectations is absolutely key here. Notice the timeline for clinical benefit. All of these powerful nutraceuticals, including CoQ10, which lowers potent inflammatory markers, require about 3 months of consistent daily use to truly rebuild the brain's energy reserves. This isn't a quick fix like popping an aspirin. This is structural, metabolic rehabilitation.
All right, Section 3, botanicals and lifestyle, calming the system. When we're talking about cluster headaches, which patients often describe as literally the most agonizing pain a human can experience, speed is everything. High-flow 100% oxygen therapy is a gold standard treatment that provides immense relief for most patients in just 15 minutes by calming the autonomic nervous system. It's wildly effective, and unlike injectable sumatriptan, it completely avoids any cardiovascular risks.
Now, while these herbal therapeutics might sound like they belong in antiquity, modern science is actively validating exactly how they work. Feverfew, for example, inhibits serotonin release. Butterbur acts as a powerhouse anti-inflammatory, though, critical note, it absolutely must be a certified PAP-free formulation to be safe. We're also seeing kudzu root emerge as this fascinating modulator for cluster headaches. And simple 10% topical peppermint oil, that can halt a tension headache in as little as 15 minutes just by stimulating cold-sensitive receptors.
But look, we absolutely cannot ignore lifestyle. Honestly, you just can't out-supplement a totally dysregulated nervous system. The migrainous brain absolutely craves homeostasis. That means establishing a strict biological clock, waking and sleeping at the exact same time every single day. You also have to maintain steady hydration to prevent pressure-related pain from brain tissue shrinkage. And you've got to ruthlessly limit your caffeine to under 200 milligrams a day to avoid vascular instability and those awful rebound headaches.
Which brings us to Section 4, Interactions and Hidden Dangers. The reality check.
We really need to bust a dangerous myth here. Just because something has the word natural on the bottle doesn't mean it's 100% safe or lacks potent interactions. Take Q10. Structurally, it's very similar to vitamin K. So if you're taking a blood thinner, like warfarin, Q10 can actually counteract your medication and spike your risk for dangerous blood clots. Similarly, feverfew naturally thins the blood, so combining it with NSAIDs, aspirin, or warfarin massively increases your bleeding risk.
This is exactly why clinical oversight is just mandatory. For instance, pregnant women should never take feverfew because it can actually trigger uterine contractions. And remember butterbur? Well, in its raw form, it contains pyrrolizidine alkaloids, or PAs. These chemicals are highly toxic to the liver and potentially carcinogenic. So buying cheap, uncertified butterbur extract risks severe liver damage. These are really powerful agents with very real toxicological profiles.
Finally, we're at Section 5, SNOOP, Spotting Medical Emergencies.
Okay, you're going to want to literally burn this acronym into your memory, SNOOP. It is the ultimate clinical screening tool for red flags. If a headache comes with systemic signs like a fever, neurological deficits like weakness, if the onset is sudden, if the patient is older than 50 with a brand new headache, if the progression is worsening, or if the pain is positional, listen, these are critical warning lights. They indicate that the physical system is structurally failing and it is time to put the supplements down and get to the emergency room immediately.
Let's actually see these red flags in action. If someone experiences a sudden thunderclap headache, meaning the pain reaches its absolute maximum intensity within 60 seconds, that is a classic sign of a subarachnoid hemorrhage, which is a bleed in the brain. It demands a stat CT scan, no questions asked. A fever paired with a stiff neck implies meningitis. A brand new headache in a 55-year-old, that could be giant cell arteritis, which risks permanent blindness if you miss it. Natural remedies are incredible, but they are absolutely never a substitute for emergency medicine.
So, as we wrap up this explainer and look toward the future of personalized, integrative headache medicine, the data clearly shows that targeted natural compounds are highly effective. But, they work differently than standard painkillers. They require time, consistency, and a lot of clinical vigilance. So, ask yourself this final provocative question as you consider your own health. Are you just temporarily numbing the symptom, or are you ready to finally provide your brain with the bioenergetic fuel it needs to heal the system from the inside out?